Dr. Garrett Sullivan's back there in the striped sweater. He's a medical doctor that assists me with treatment of patients that come to our clinic, and he's also involved in research. And little do you know that he's probably going to be the person that researches this type of therapy in the future. So he's got a lot of great ideas about future research direction. Yes. So, and I also put a survey at your desktop. This is very important. Garrett and I wrote, along with Kay Chin, we did some experiments with glutathione in an animal model, and we wrote our paper up and we sent it to the publisher. And in the paper, we wrote that doctors give IV glutathione, and the reviewers wrote back and said, well, that's all very well, but how can you prove that doctors give IV glutathione? We can't find that anywhere. And so they asked me to document it, so that's why I'm doing a survey. So if you could fill it out and turn it back to me, I'd be most appreciative. And even if the answer is no, you don't give IV glutathione, fill it out anyway. So, and then what we've decided to do is I'm going to go through these slides pretty quickly, and then we're going to have a half an hour. Robert wanted to have an extra half hour to talk more about the IV hydrogen peroxide, a question and answer period, and then maybe the IV vitamin C if you're interested. So let's get started. I just want to first say that because I'm at the University of Kansas Medical Center and I'm doing research and I'm as well as treating patients, I really felt like one of the responsibilities I had to all of you and to this field is to remain completely free of any financial conflict. So I don't take money from producers or supplement companies or anyone. Okay, now this is a very sophisticated crowd, so this question probably will be easily answered by you, but and we're going to answer it later, so don't answer it now. Intravenous ascorbic acid is effective because it is a powerful antioxidant. Well, the history of IV vitamin C is very interesting because in the 20s, Dr. St. Georgi identified this molecule, which he called hexuronic acid, and because of the identification of this molecule that subsequently became known as vitamin C, he won the Nobel Prize in 1937. And he had wonderful quotes. He was just really a very interesting man. But I think this embodies all of the doctors that come to these types of meetings, because he said discovery consists in seeing what everyone else has seen and thinking what no one else has thought. And so not just following the herd, but really trying to understand what are those anomalies we're seeing, and really understanding that there's a different way of practicing medicine. Well, in the 1930s, there was really quite a bit of research that was going on around vitamin C, and they realized that it was a wonderful anti-infective agent. And Dr. Klaus Jungblut in the 30s started looking at the use of vitamin C, and he called it really an adrenal cortical extract and medullary extract. There seemed to be something very powerful in these fluids from these organs that quenched infection. So there was a push at that time to really try and understand the treatment of polio. And so he used the polio model as a way. He also looked at other infections like diphtheria and other bacterial infections as well, and the use of vitamin C. So his experiments largely centered around the use of rhesus monkeys, and he had them inhale the polio virus intranasally, and then he treated them with IM vitamin C at different levels. And he found that there was significant attenuation of the effect of the polio virus in this model of rhesus monkeys. And this prompted a lot of other research to be done during this time. And I thought this was really interesting. This was at the end of his paper. He was thankful to Merck and Company. So things have really changed quite a bit since the 30s in terms of the pharmaceutical companies. But they, at that time, were one of the largest vitamin C producers in the world, injectable vitamin C producers. Well, in parallel to the doctors that were studying the viruses in animal models, there was a woman, Mary Lutchkin, who was looking at the use of vitamin C in tobacco mosaic virus. And she had a really interesting set of experiments that I think were just way ahead of her time. But she references the work in the animal model in various bacteria and viruses related to the anti-infective effect of vitamin C. So she set up a series of experiments, and she had an idea that it had to be an oxidative therapy. There was an oxidative effect from vitamin C, and she set about to prove it. And what she did was, and it's really, for some reason this projector's not projecting this very well, but along the y-axis, it's the ascorbic acid that's oxidized, and along the x-axis, it's time. So here we have the ascorbic acid in solution, and she's added a transition metal. In this, she's used copper. Okay, and about this point in time, the tobacco mosaic virus was inhibited. But if she added catalase in varying amounts, that effect was quenched. So she's suspecting at this time in the 30s that hydrogen peroxide was at work with vitamin C. No one picked up on this. And in the meantime, Klaus Jungblut is continuing to work with the polio model in the rhesus monkeys, giving different levels of inhaled polio virus and different concentrations of vitamin C. And he continues to find that the rhesus monkeys that received the vitamin C had less incidence of paralysis than those that received the saline control. So this work is being published repeatedly. And then subsequently, Sabin, who is well known for the polio vaccine, repeated the same set of experiments. But what he did was he gave a larger dose of polio virus and gave it twice. Jungblut also gave his intranasal polio virus twice. But Sabin used a much larger dose, and then he gave the vitamin C subcutaneously in the manner similar to Jungblut's experiments. But what Sabin found was that there was no benefit at all from the injection of vitamin C. And he does mention that some people criticize this experiment, or they could criticize it because he gave such a high dose of infective agent. And of course, if you're giving subcutaneous vitamin C, you're not going to get a very high dose. So that could be the problem indeed. But anyway, because it was Sabin and because it was negative, what happened was it drove this therapy underground. It was completely stopped. It was no longer funded. Well, we all know that Dr. Klenner in North Carolina picked this therapy up and continued using it through the 40s, well into the 70s. And there's an interesting story that Wayne Jonas gives. Was the director of the Office of Alternative Medicine at the NIH. When he was in medical school, he visited Dr. Klenner. He heard about this great work with IV vitamin C that Dr. Klenner was doing. So he thought, well, I'm going to take a weekend and go down there and visit Dr. Klenner from his medical school rotations. So he went down there, and Dr. Klenner welcomed him in the clinic, and he had a patient with measles on the table getting IV vitamin C, and Dr. Klenner said, come in here and look at this. And he turned down the vitamin C, and the measles rash reappeared. Then he turned the vitamin C back on, and the measles rash disappeared. He did that a couple more times, and Wayne just was sold. He thought this was the best thing since sliced bread. So he goes back to medical school. He's on rounds in internal medicine. There's a patient with an infection, And the attending said, well, what would you do for this? And Wayne says, well, I think vitamin C, IV vitamin C might be a good thing. So he immediately gets drugged into the chair's office, and he had to repeat his rotation in internal medicine. So anyway, he learned very quickly you don't talk about those things in medical school. Although our medical students now are starting to talk about IV vitamin C. But anyway, Dr. Klenner really kept this alive. He, as you know, did lots of work with multiple infections, bacterial and viral, and really influenced, because of his persistence with this therapy, he's influenced all of us, really. So we have to be indebted to Dr. Klenner. Well, here we are in the modern age, and I apologize you can't see this, but it is a doctor covered with patches from all the pharmaceutical companies and device companies, and so we're now in the modern age of medicine. And along comes Linus Pauling and Ewan Cameron. Now, Ewan Cameron was a Scottish surgeon, and he started giving his cancer patients 10 grams of IV vitamin C, followed by 10 grams of oral vitamin C, and found that they had improved outcomes. Linus Pauling was starting to get interested in vitamin C at that time, so Ewan Cameron contacted him and said, please come over here and look at my patients. So he went, and he saw that the patients were really doing very well when they should have died months before. So Linus Pauling and Ewan Cameron published several papers through the 70s looking at what's called case-controlled studies. They really didn't do randomized studies, but they did a group of patients in Ewan Cameron's clinic and then compared them to matched patients of the same age and tumor type. Well, this is not a randomized controlled trial, so Linus Pauling went to the NIH and insisted that they replicate this trial. He was the one that got the funding together through the NIH to do the study, and the clinic that was awarded to the study was the Mortel group at Mayo. So they did a randomized controlled trial. They gave 10 grams of vitamin C or placebo to their enrolled subjects. And at the end of the study, they couldn't find any difference between the vitamin C group and the control group. So this was reported in the New England Journal of Medicine, and again, killed vitamin C research. Now, what is not known and really wasn't pointed out, even Linus Pauling didn't realize it at the time, was that the Mayo Clinic group gave oral vitamin C, which is a vitamin and an antioxidant, and the Ewan Cameron had used IV vitamin C, which of course we know now is a pro-oxidant. So about this time, it's driven underground again, and about this time, Mark Levine graduates from medical school, and he's really unhappy because in his medical school he realized how important biochemistry was and how these basic vitamins and minerals were really driving the biochemistry, and nobody paid any attention to that in medical school. So he decided he was going to dedicate his life to studying the biochemistry of nutrition. So he goes to the NIH thinking that there would be people there to help him in his research, and nobody was interested in it. So he had to figure out how to set up a lab, do all the basic science research. So he's doing this late 70s through the 80s, and he starts doing some of the basic underpinning work. And he picked, out of a hat, he picked vitamin C as his model vitamin. He had no vested interest in vitamin C. Serendipity, whatever. But anyway, he published this paper in the 90s, and he's looking at oral vitamin C in healthy men and women. They go into the NIH. They're depleted completely of vitamin C through their diet. They have to stay there for 6 months. And then they get repleted with vitamin C. And he follows what happens to the vitamin C. So if you look, this is in micromolar concentrations in the blood, in the plasma, and at a certain threshold, 60 micromolar to about 80, and some people it can even get up to 100 micromole, but there's a plateau effect. So at this point, there's decreased absorption and increased excretion. So oral vitamin C is tightly controlled. Okay? So he was interested in IV, and he gave a 1-gram dose and then computer modeled it to a 10-gram dose and found that with IV administration, you bypass tight control. So now you've got a drug, vitamin and a drug. Okay? So he published it and, thought people would be interested in it. And, some people were. But who was really interested in it was Hugh Reardon. Now, some of you knew Hugh. And for those who don't, he was a pioneer in IV vitamin C research. And he was in Wichita, Kansas, and had a wonderful complex there, including not only the clinic practice where he gave IV vitamin C. He was really one of those pioneers that kept the IV vitamin C alive during these lean years. But he also had a basic science lab, and they did basic science research there on vitamin C. So Hugh read that report by Mark Levine, and he went to the NIH. And Mark told me subsequently that Hugh bugged him unmercifully to look at vitamin C as a drug. And Mark was going, yeah, right. But anyway, he finally convinced him to look at some of his patient files. So out of that, and you can sort of see here that Hugh Reardon's name is on this paper, and Mark Levine is the chief author here. So they found 3 cases that fit NIH muster, and they had all their slides reviewed. They didn't get any other therapy for their cancer except IV vitamin C, so it was the perfect 3 cases. And they showed convincingly that there was evidence for benefit from this oxidative therapy being given intravenously on these tumors. So this is a picture of Mark Levine here, and this is when Kay Chin was in his lab as a postdoc, and then there's some recurring names, Sebastian Pattiatti and Mike Espy over here. So these are recurring names that you'll find on a lot of these papers, and this lab has really done some of the seminal research on IV vitamin C. So this was the first paper, and Kay Chin is the lead author because that's what you do with your postdocs. You start training them to send them out, and we've been very fortunate in that Kay Chin has now joined our group at KU Medical Center and is an independent researcher and really doing a lot of great work with vitamin C. And what's really nice is that we have once a month, we have chart review every Friday. We have teaching and review of charts, but on once a month, Kay and her lab come over and we just sort of brainstorm of what we're going to do in the future in terms of research. So it's been a wonderful collaboration. But anyway, this was their first paper published in the Proceeding of the National Academy of Sciences, no slouch of a journal. And they talk about giving vitamin C in cell tissue culture. So we're starting with cells. This is the way you do. But they mimic the way that Hugh gave the IV vitamin C in his clinic. So they wanted to make it as close to the way humans were receiving it as possible. So they had a number of cell lines, and what's really exceptionally interesting about this is that when you have normal cells here, it doesn't matter how much vitamin C you give, it doesn't kill the normal cell. But if you have a cancer cell, the majority of cancer cells are sensitive to the vitamin C at some concentration. These are resistant tumors right here. So it doesn't kill all the tumors. It's not a panacea. But it does show that it seems to be targeted to an abnormal cell. Now, this is, again, the same thing. These are normal cells here, and that's a lymphoma cell, and it just shows the amount of cell death with increasing concentrations of ascorbate. And most of the cancer cells are exquisitely sensitive to ascorbate. And what seems to happen is not apoptosis, but pycnosis and necrosis. So it's a little bit of an interesting mechanism, the way the cells actually die. Now, I added this slide because when I trained with Hugh Reardon in the 90s, I thought, this is what Hugh thought, and Steve and I were just talking about this before the lecture, that the ascorbic acid became dehydroascorbate and was taken across the cell membrane on the GLUT transporters, the glucose transporters, into the intercellular environment, and it was the dehydroascorbate. That was his theory. It was the dehydroascorbate that killed the cancer cells. Well, because this theory was so prevalent, Levine wanted to look at this, and they actually used a model in the cells using dehydroascorbate and ascorbic acid. Because he found that Lichkin paper, Mary Lichkin paper, and he had a pretty good idea that it was some sort of a pro-oxidative effect that was occurring, and it wasn't the dehydro in the intercellular space. So that's why he did these experiments. So if you hear that theory and you still will read that theory, it's not accurate. And he's shown here that dehydro is not the agent, the agent of necrosis. He did both. He put it extracellular and intracellular. That's a good question. He had to answer that question, but it's not the dehydro, it's the ascorbic acid. And then he did this set of experiments to prove that it's probably a pro-oxidative effect. And here he's using saline and then several methods to quench hydrogen peroxide here. And very effectively showed that there was no cell death when you added catalase and the manganese TBAP or with control. So here he's showing that indeed it's hydrogen peroxide is the mediator now. So this is the first time in modern history that hydrogen peroxide is being implicated. And then he thought, well, I need to show that I have these cell lines, and I'm going to add hydrogen peroxide now. And the curve was very nicely replicated by the addition of hydrogen peroxide to his original work with the ascorbate. So here he's confirmed that it is a hydrogen peroxide molecule. Very elegant set of experiments. Okay, now this is important, I think, for the hydrogen peroxide, and Dr. Hasselblank he commented on this before, and this is very important, is that, I don't know what's happened to that projector. It's black and white and not color. But anyway, this is the this is the intravascular space here, and this is the extracellular space. So this is where the money is here for vitamin C. You give vitamin C in the vein, you form the ascorbate radical. This was their theory before their next set of experiments. You form the ascorbate radical. It interacts with the transition metal. It could be iron. It could be copper. We're not sure or it could have been all of them. We're not sure exactly what metal it is yet. But it forms hydrogen peroxide. But in the bloodstream, is very quickly quenched, as was mentioned in the last lecture. But in the extracellular space, it is not quenched very quickly. So that was the theory at the time. So they set up a series of experiments in animals. So we all know that indeed intravenous ascorbic acid, given in the vein, ascorbic acid is effective because it's not a powerful antioxidant. So that statement is false. So it's a pro-oxidant. IV ascorbic acid is targeted to abnormal cells, whether they're infected or cancer cells, whatever it is. It's pro-oxidative, and this happens because of the production of hydrogen peroxide. So here's the next set of experiments that Jeanne did in Mark's lab. And now she's looking at a rat model, because it was kind of like, so what? You've done these cell tissues, and, so what? You've generated some hydrogen peroxide, big deal. So what they had to do is set up a rat model, which is normal rat, and show that by giving injection in the tail vein, there's an injection here of the ascorbate right into the vein, and then they gave it by mouth. So you're giving it IP, IV, and orally. And they gave the amount of IV vitamin C that would mimic what we give to humans typically. And then they also did a really interesting thing, and you can't even see this, but Over here, there's a dialysis catheter that was implanted into the leg, to the flank of the animal, and they dialyzed off fluid and then measured it for ascorbate, ascorbate as well. And that's the extracellular space. So they're not only looking about what's going on in the bloodstream, but what's going on in the extracellular space by this dialysis method. Yes. Yes. It's that space around all of the cells here. There's a cell here, and there's just this wonderful space here. I think it's where the action is for a lot of things, actually. And it's got a matrix. It's got a 120-day lifespan. It turns over just like, blood does. And the plasma flows in there, and that becomes lymph. And the blood cells come in here, the white cells. I mean, this extracellular space is the coolest space in the body. It also exchanges with the intracellular. Yes.
There's another term for it. It's called the interstitial.
Yes. So what Mark did then was Jeanne actually looked at was the amount of ascorbic acid in millimolars now, instead of micromolar, millimolar. This is pretty good level here over time. So in the blood, you get a peak and a fall off. In the intraperitoneal space, you get a nice peak. Orally, it doesn't matter how much you give orally, even liposomal vitamin C, you're not going to bypass tight control. So that drives me crazy, actually. I get that question every time I speak about this. So anyway, you do get a very interesting peak. Now, in the extracellular space, or that interstitial space, you also get a very nice peak. So this proves it's being driven into the extracellular space. Oral ain't going anywhere, okay? Little bit. So then the next part of this was looking for that radical, that ascorbate radical, and they had a very sophisticated way of looking at the ascorbate radical in this rat model, and indeed they were able to prove that the ascorbate radical forms. And then they did another set of experiments where they had it was linked, the hydrogen peroxide was linked to a fluorescent molecule, so they were actually able to measure the hydrogen peroxide in that extracellular space, which is really also a very cool set of experiments. And again, you get hydrogen peroxide, you get a really nice peak with the IV. You do get some peak with the intraperitoneal, and I'll tell you why they had to do this in a minute. Again, oral, you don't get much hydrogen peroxide, essentially none with the oral in the extracellular space. Then there was this next set of experiments in a cancer model, and then this is when we started working very closely with Mark in the early 2000s. So what they did in this set of experiments was this is a very typical tumor model, the nude mouse model. And what you do is you select your tumor cell lines that you're going to use, and you inject the tumor into the flank of the animal. And then when the tumors start to grow, and you can first measure them, then you divide them into two groups, saline and vitamin C. And then you treat them. And the reason you have to give this intraperitoneally is that in a mouse, you can only inject that tail vein one time, and then it's sclerosis. Doesn't matter what you use. So they knew they were going to have, that's why they did the IP with the rat, just to make sure that they could get it in. But what they had to do was give the vitamin C twice a day, just so they could get enough in the animal to mimic IV. So that was pretty good thinking, I think, on their part, because if you didn't do that, it might look negative, like a negative study. So anyway, here we go. Ascorbic acid in millimolars, time after the injection. They measure ascorbic acid in the extracellular space again. So that's a dialysis catheter in the flank. So we've got the blood level, the subcutaneous level, and they were able to implant a dialysis catheter in the tumor and measure vitamin C going into the tumor, which is pretty cool. Then they looked again, ascorbate radical, time, and subcutaneous, tumor, and blood. And again, look at blood is, you're not going to develop that ascorbate radical in the blood. It's quenched. But this is my favorite slide of all, because look at this. Hydrogen peroxide formation, the amount of hydrogen peroxide in time, and look what happens to the tumor. It takes it up and it holds on to it for 150 more than 150 minutes. 3 hours, you're still holding on to that hydrogen peroxide in the tumor. That is news to use for all of us. It's in the extracellular space. Milieu, absolutely. And I've got a little cartoon here I'm going to show in a minute. This was the glioblastoma model for the mice. And what they did was, this is the saline control, and tumor volume. They measure tumor volume over days of treatment. And then the treated is the intraperitoneal vitamin C. So the tumor volume was significantly reduced in the treated animals. And in the metastatic disease, the control group had metastatic disease, the treated group had none. Glioblastoma is very exquisitely sensitive to IV vitamin C / hydrogen peroxide. So that was one of the reasons it was chosen. Ovarian cancer model, they looked at ovarian cancer because of our work, our small trial in ovarian cancer in a clinic. And again, significant reduction in the tumor volume in that model. And then this is the patient data from our lab that was used in that paper in 2 of our small clinic trials, showing that indeed in humans you're going to get a very nice rise up to 20 millimolar and more by increasing doses of vitamin C. So this was the first time any human data has been published in this regard. So this was what, out of those series of experiments, what the final, the takeaway message is, and that's either IV or IP ascorbate bypasses tight control, so it's a drug. And by bypassing tight control, intraperitoneal ascorbate significantly inhibited tumor growth. And after IV or IP ascorbate administration, peroxide ascorbate radical and hydrogen peroxide formed in the extracellular fluids but not in the blood. Okay? And taken together, pharmacologic concentrations, or IV ascorbate, generates ascorbate radical and hydrogen peroxide in the tissues and may have unanticipated, and I always say that was his expectation, not mine, because I trained with you, unanticipated promise as an anti-cancer agent, and may have implications on disease that hydrogen peroxide or reactive oxygen species have therapeutic roles, such as infection. So this really opened up a big, it's just so exciting. It just really revolutionized the way we're looking at this. This is a cell here, and we talked about the extracellular and intracellular milieu, and the hydrogen peroxide, after being formed by the radical, hydrogen peroxide easily diffuses into these cells. Now, a normal cell will have mechanisms to quench hydrogen peroxide, and that's what we believe is why it's unharmed. But hydrogen peroxide does, this is our current theory, and currently we're working on this in Kay's lab, is what's the mechanism? And one researcher that spent her whole career in hydrogen peroxide at the NIH told Mark, it's going to drive you crazy because you can't follow this molecule. It goes everywhere. It does everything. You're going to be banging your head against the wall. But we believe through the Warburg effect that there's change in the dynamic of how the energy is produced in the cell. And again, as Garrett points out frequently, it's the flow of the electrons is what's key here. the DNA damage, which allows the cells then to go into cell death, and then direct DNA damage, which does the same thing. So there's probably dozens of mechanisms how hydrogen peroxide works in this case. Now, I just want to tell you that I want to thank all of you who helped with this previous survey we did, and we published this in PLOS Medicine in 2010. And this was how vitamin C is used by you guys. And so I appreciate the help with the survey very, very much. No one had any idea how much vitamin C was being given to patients. And what happened was they were so incredulous after our 2006 survey, they asked us to repeat it. So I repeated it in 2008 at an ACAM meeting. And the data, those data matched perfectly. And so then they published the paper. If you want to know the truth, I think this paper is what prompted the pharmaceutical companies to talk to the FDA. Now, I don't know this for a fact, Gary, so don't publish it. To tell the FDA they've got to clamp down on these guys, okay? So I think that's what happened with this McGuff. And if you look at the McGuff action letter from the FDA, it isn't just vitamin C. It's magnesium, and it's the B vitamins. So they're clamping down on the Myers cocktail is what they're doing. But through the Alliance for Natural Health, and if none of you are members of that, I would highly recommend you join ANH, because they got on this. As soon as that letter from McGuff was out, within the week, there were 15,000 letters to the FDA through the ANH website, and they put the brakes on. So I think now we've got a strong voice. We're being proactive instead of reactive, and not always on the defensive. They're not what they wanted to do was carve out one manufacturer, McGuff, and make an example out of them and scare everybody else. That's how they do. They isolate the weak one from the herd and take us down. But anyway, they couldn't do it in this case. So we're not going to go underground again this time, 2 other times that it's happened. We're going to continue and prevail. So anyway, thank you for that. And then this is our clinic at KU Medical Center. We really are in the heart of the medical center. The School of Medicine, School of Nursing are on the west side, and then on the east side of our clinic is the hospital. And we're in a building that straddles both of those complexes, and so I always say we're in the heart of the medical center. And this is really accurate, because I think not only the vitamin C, but all of the other therapies that we're all using really are making a difference in patients' lives. And so, I learned that at ACAM, and I'm just going to thank Gary, because Gary told me to join ACAM a long time ago, in the 90s, so I did. Yeah, I appreciate that. Yeah. So anyway, and the reason I have that survey on your desk is because we did a research project in glutathione, and Garrett and I wrote it up with Jeanne, and we were trying to get it published, and we said, as I told you, well, prove to us that people actually give IV glutathione. So hence the survey. So if you could fill that out, even if the answer is no, I really appreciate it, because you can see the impact our surveys have. So thank you very much.